Hello, everyone, and welcome. My name is Scott Johnson from Blue Circle Health, and I'll be your host today. I've lived with type 1 diabetes for over 45 years, and just really glad you could join us today for our webinar. I'm thrilled to be here alongside two very special guests. We're hoping to have an open and informative conversation about the unique challenges faced in aging with type 1 diabetes and the resources available. Now, before we get going too far, I do need to cover some quick housekeeping items, and then we'll do brief introductions. So again, we welcome and encourage you to use the chat feature along the way. I'll keep an eye on it throughout the session if you need anything during the presentation. This session is being recorded. Participation in this event is completely voluntary and may reveal your identity and any identifying information that you share with other group participants, for example, comments in the chat. We are not providing medical advice, individual or otherwise, and may refer you back to your healthcare team for detailed and individualized care. And finally, for anyone who's not familiar with Blue Circle Health, stick around till the end and I'll share a brief overview and answer any questions that you may have. So again, please feel free to drop your questions in the chat at any point, and I'll pop in and share those with the speakers as time allows. All right, well, thanks for your patience with all of that. Let's get started with some quick introductions. And Kelly, why don't you introduce yourself first, and then Joanne, you can do your introduction and lead right into your presentation.
Hi, so I am Kelly Dawes, and I am the founder and executive director of a nonprofit organization called Grownup T1Ds. We host social in-person meetups to get community together and create that connection that's needed amongst those of us living with type 1 diabetes, particularly those of us in midlife and aging with type 1 diabetes, which includes, of course, your adult onset. And I've lived with type 1 for over 44 years. Go ahead, Joanne.
Hey, everybody, I'm Joanne Milo. I think I trump you all. I've lived with type 1 diabetes for 60 years. I'll be 61 in January. I'm ready to give it back, but nobody wants it. And I've been always very, very involved in the T1D community since I was diagnosed at age 11. My parents taught me to talk to people, and I was terribly embarrassed, but I thought, okay, that's what we do. And so I've always been involved. I've always done fundraising and got very involved in about 15 years ago on my first hospitalization that was unexpected, and realized not only am I managing my diabetes, but when I'm in the hospital, I need help. And I didn't understand all the parts that were involved with that. Out of that grew what I thought was a booklet. It turned out to be a book on how do you survive being in a hospital? How do you survive talking to your doctors and getting advocates? And from that became a blog called The Savvy Diabetic, where I just share information about research and technology and what's going on in the community. It's a weekly blog. And that was all chunking along just fine. I'm an early adopter of technology. I'm involved in the open source community and founder of Loop and Learn for the open source algorithms. And about 6 or 7 years ago, I started to realize I was aging. It kind of crept up on me when I was first diagnosed, as many long-termers have been told, you will not live past age 40. I was 11 at the time, and that was the expectation. And I realized when I was in my 50s, I had surpassed that age deadline, and what was going to happen as I aged, and what were the issues. And I gathered a bunch of friends who had long-term T1D in my dining room and said, what are we scared of? What do we need? What is not in place for us? We know hospitals can be very, very tricky. We know interacting with our healthcare professionals as we become more complicated as we age, it gets to be a little bit more challenging. And then the reality of aging is there's a lot of loss. There's a lot of loss of ability. There's a lot of loss of ability to drive. You can lose a partner. Your friends are no longer around. And who's going to take care of me? I've told my husband um, that he has to live past my death. He can't go first, and if he does, I'll just dig him up and kill him. He just cannot leave me alone, and that's it's our amusement, but it's not reality. Um, and I started to feel like I wanted to know how to be prepared. And all through COVID, I was pushing the community to get prepared, have a go bag, because you never know when you're going to need to run out the door, go to the hospital, or on a more positive note, someone shows up at your door, says, "Here are 2 tickets to Paris, leave now," and you grab your go bag and you're good. So it's not all negative, but so I developed a little cheat sheet on how to develop that go bag, and I developed a cheat sheet on how to develop your personal medical resume so you have all your medical information together. And if you end up in the hospital, you can put that on the nightstand and they can see what your dosing is and what your needs are and who your advocates and your medical team are. And these are all sheets you can fill in, and just to be a little more prepared. So things happen in life. As you've probably all noticed, we're on this journey and things will keep happening. Um, and we started to try to figure out what were the topics that were most important to us. So it becomes, are you prepared? So do you have your go bag? Do you have your information together? Do you have your emergency contacts on your phone? All these things that are available to us, but most of us don't do it. And so we have a whole section. I just launched a website called T1D to 100, a whole section on how do you be prepared. Here are some cheat sheets to walk you through it. So it makes it easy and you can have it done, then you're done. Then the question is, how do you handle being in the hospital? Because likelihood is something will happen. You might fall, you might have another illness, you might have appendicitis, which is what started my whole journey. And it's something random, but you could end up in hospital. And how do you best survive a hospital who is trying to take care of your medical issue at the moment, but not necessarily your diabetes at the same time? And there's also some issues that some of the healthcare staff doesn't even understand the difference between type 1 and type 2. And it's significant. So we have some ways of managing that issue. Then it becomes, where are you going to live? Can you stay in your home? And sometimes it's possible. Sometimes you move into a retirement community. Do they cater to people with type 1 diabetes? Do they charge you more money for it? How do you be prepared and learn what your options are? Then we look at what happens to your body. It changes as you age. Certainly for women, if you've been through menopause, lots of things change, but for men as well. And we lose hearing. We have more hearing loss as T1Ds. We have vision issues. We have dexterity issues, balance. And all of those things need to be dealt with, and they happen much more frequently. If you're T1D, I don't want to get into statistics on it because it scares everyone, but it's just a reality. And what I notice on dexterity is I can't open the J7 containers. And people call me and say, I can't open mine. I say, well, do you have a rubber band? Because a rubber band will help grip the top and open it. So these are all tips and tricks that we can share in the community to help us all get through this period of time when our body is changing. Then the question is, how do we advocate for ourselves? And that's a whole big topic that we're trying to kind of get a handle on. What do we need to know? And then how do you cope with this? How do you keep being resilient? Things happen suddenly. They don't happen slowly, apparently. And when they happen suddenly, you need to be able to cope at the moment and then be resilient enough to come back and take on another day. Your device fails. Okay, fix it, come back and keep coming back. And what are the tools and tricks we can use and help each other? One of the big one is, and you'll hear it from Kelly, is community. It's a lonely disease, and the more we have community around us, the more we get kind of surrounded with good energy and the positive things that you can do. It's a help we need. And then we have all these tools, and I have this on the website, and I'm actually, may I screen share, Scott? Okay.
Yeah, go ahead and bring it up. And if I'm hearing you describe this, this is really, it's fascinating because it's something that we don't really think about until we're faced with one of the situations that you describe. But you talked about, looking at some very practical day-to-day things. Then you talked about thinking a little bit longer term in the advocacy and how to advocate for yourself. And that can be applied in many different scenarios, right? It can be applied in the healthcare scenario. It can be applied in your family scenario and your friend scenario, as well as in the government and political landscape. And then you also talked about the emotional side that comes with all of this. And so I imagine that as you are experiencing and building all these tool sets, you're just coming up with many, many more aspects to this that maybe you didn't really think about at first glance, right?
Absolutely. I'll jump to one that will get in and get out real quickly, but at some point there will be an end of life. And I didn't think much about it, and someone suggested that there is some belief that at end of life, perhaps in hospice, there's a tendency for care organizations to withhold insulin. And that is pretty horrifying, and that is basically not the thing you want. It is absolutely not the thing you want, and you can specify. So these are all things that you want to think about quickly, set it in motion, put it in your documents, and then don't think about it again until you have to. But it had never occurred to me that anyone would do that to me. And it isn't an evil thing, but it's what happens in healthcare. They think, well, we'll just expedite the end. It's not the way you want that to happen. So these are all things that the community has thought about, has experienced, and has shared. And we're saying, how do we set up tools so that those things don't happen to us and that we have the happiest end of our lives that we can ever possibly hope for? So what you're seeing is the homepage of the website. And to give you the overall purpose of what I'm trying to do is share this knowledge and create this community so that we learn, we're prepared, and then we could just live our lives. The second part of it is to interact with the research community, which we're doing very successfully. And they're the ones that we can go to, and they want to hear from us on what our concerns are and how can they validate that it's important so that they can put out research papers and then teach it to the healthcare providers who really literally don't know what to do with us. And we are more complicated as patients. We take more time. Things can happen quicker as we age. The quickest that can happen is you could take a spill. You can trip over carpeting or a little pet, and suddenly you have medical needs. I've also found, and this is just very personal, that the healthcare providers really possibly don't prefer to work with us as we age because we take more time. They're not compensated more. And we're not as cute as 10-year-olds. Maybe some of us are, but most of us probably are not. And how do we help our healthcare providers enjoy taking care of us and understand what we need? It's kind of the next important step. So this is the homepage. You can easily navigate to the sections that you're curious about. We have topics, so it's easy to see as you navigate the website. And then we have basically a blog. So we're doing interviews with people who have been through interesting experiences or items in the news. And that shows up. And we also let you get on social media. So I have this, by the way, this is the resource. We have tons of resources that you just feel like reading sometime. We have a Facebook group, which is growing pretty rapidly, where we upload information, people share information, and we also put out pretty much weekly quotes that are somewhat amusing about aging because we're going to be doing it anyway, so we might as well have some fun with it. I also have an Instagram page, and we are also on LinkedIn. So it's every way we can help the people in our community be there. What you'll hear from Kelly is about how to develop the support network and be involved. And so many people ask me, how do I get a network? How do I get Dying Buddies? And if you don't have local groups near you that you can go in person, there are Zoom events that are out there. Some organizations have walk and talk events. And so we list those as well. And we also have cheat sheets on how to start your own, because the best thing you can do for yourself is have a community that understands what you're talking about, and it feels better. You have someone to pick you up when you're just kind of knocked down, and that's so important. So that's it in a nutshell.
Thank you so much, Joanne. I find a tremendous amount of value in just simply not having to go through a situation alone. And if I can buddy up with or talk with or learn from someone who has experienced a similar situation or has some knowledge in that area, it just makes things so much easier. So I really just appreciate you championing this cause and pulling people together and pulling all these resources together. I know you've got a tremendous group of people behind you that are also helping, but it's really nice of you to come and just share that this activity is happening behind the scenes. So we will be sure to share out all the links, and if you're open to it, I'd love to include the slides in the follow-up email that I send out. And yeah, we've got time for questions too, but why don't we, folks, if you have questions, go ahead and start adding them in the chat, and we'll turn it over to Kelly to talk a little bit about the community aspect of things and how important community is for living well with T1D. And then we can come back together for more of a discussion and handle questions after that. So, Kelly, I will turn it over to you.
Thank you. Okay, yeah, so after the pandemic, well, first of all, diabetes is isolating enough as it is, right? And then the pandemic happened and we were isolated. And so after things opened up, I contacted a few friends. I've always been involved in the diabetes community, so I knew some local friends. We had dinner and it was fantastic. You know, it felt like there were so many virtual meetings that existed and so many popped up during the pandemic, and they served a great purpose, but we were missing the human connection. And when we did that, it just kind of snowballed from there. The other thing is that, you know, being in my 50s now, I felt like there wasn't really a place for me, that I didn't quite fit in with some of the organizations. And we were an underserved population. It was so obvious. So along with Dr. William Polonsky and some board members, we created Grownup T1Ds, which is the first and only organization serving the midlife and older aging type 1 diabetes community in the United States. And it's been needed. I mean, we're one of the largest groups. It's the first time we're living this long, thanks to advancements and, you know, medical advancements. And there's a huge group of us. And then add the adult onset, you know, type 1s, and they really didn't have a place they fit in as well. So we created that. And what we focus on is in-person versus virtual. We have peer support. I call it a support group, but it's social and it's uplifting, and people network and connect. I mean, connection is medicine. With age, isolation goes up, it increases, right? And living with diabetes, again, is already so isolating. So that's detrimental to our health. We need the human connection. And what happened was this nonprofit I created exploded. I mean, it just grew, and I'm getting emails and messages from all over the United States. So sooner than expected, we expanded, and we have a chapter now on the East Coast in Boston and one in Denver. both launching their first meetups for this month for Diabetes Awareness Month, and others are in the works currently. So, as people step up, we're 100% volunteer-based organization. And so people are stepping up saying, I have a CDCES who's lived with type 1 over 50 years, who's ready to do one in Seattle. She's relocating back to Seattle. We have Florida, we have New York, we have all these places coming and saying, we want to do this here. So, there's an urgent need for this. We're filling an unmet need for a group, a demographic that really were not being served, even if you're on, kind of social media. It's a little bit younger, and social media is fantastic, but you don't see a lot of us that are a little bit older living with type 1 diabetes. And, I say all the time, what am I going to do? Am I going to post on social media? Hey, you guys, how did you navigate that colonoscopy? Or what did you do with menopause? These aren't things we're just going to shout out on social media. But when you get a group of us together who get it and who understand and speak the same language, everyone opens up, and it's such a supportive, incredible community. So it's been extremely rewarding. There's some things that happen. I mean, it's been 2 short years that we filed as a nonprofit. And those 2 short years, we had 2 of our own, very own, we call them family, but, attendees, regular attendees who lost everything in the wildfires. And we were able to, last minute, throw together, organize a donation drop-off in January for those people. We ended up with so many supplies that people were shipping from Europe. And we had an overflow. We were able to give it to other organizations who were also helping people from the wildfires. We've had people with cancer reach out. And because of such a large community now, I'm able to refer them to others who've dealt with that and live with type 1 diabetes. And they support each other. We've had, oh my gosh, there's just so many things that have been happening. Just last month, 2 of our board members spoke on Capitol Hill in regards to diabetes policies and urgent needs within. We're all about education, advocacy, peer support, uplifting. It's a very social environment that we host in. So it's not your traditional type of thing. We don't host in clinical settings because that's the last thing we need. That's all we do is go to doctors, fight with insurance companies, chase prescriptions. So we host in sports bars, breweries, restaurants. We've done a hike. It's not clinical because the last thing we need is another lecture on foot care. We're already all consumed by this disease. We focus more on peer support and just uplifting each other. It's been incredible. And
Kelly, can you talk a little bit more about what you've learned over the past couple of years in putting these events together? And I remember when you first started and you weren't sure there would be enough interest, and now you've got people asking how they can get involved from cities all across the nation. Talk a little bit about what that journey has been like for you.
Oh, it's been so overwhelming. The emails and the direct messages and they're saying, I've been alone with this for 50 years. I need a community. I really wish I had something like that here. Or someone will reach out and say, I'm ready for this here in Florida. I'm happy to help if there's a way I can help. And I do reach out and explain to them it's 100% volunteer. It takes some time. We don't charge for anything. It's absolutely free. So, what I'm telling people, and I hope more will reach out because we would love to continue to open chapters in other cities and reach more people in midlife with type 1 diabetes who need this support or who have felt alone, and to fight the isolation, the burnout, and everything that comes with carrying this disease. What I tell them is that I do need a chapter leader, someone who's ready to volunteer and do it. And that would mean finding the venues to host at. I really want to avoid the clinical setting because we don't want more of that. Doing the emails, just sending out the emails and announcing and planning the events. There's no cost involved. They would fall under are already established 501c3 nonprofit, which saves them money or the work of having to do that. So what we do is, like, as an example, in Boston, I'm filing in Massachusetts in that state. I have to pay the fees and file, but they still are able to fall under our umbrella. So their events will be listed on we're on social media, on LinkedIn, Instagram, TikTok, Facebook, what else? I mean, everything. And so we announce it. Also, because we're a nonprofit, we get a certain amount of money worth of Google ads. So I do it through Google ads, and I announce their events as well. And so, I mean, there's a lot of benefits of it, but they just have to put in the volunteer work when they lead a chapter in their city.
And when someone that's watching today or listening to us today would like to learn more about the events that are happening, where can they go for additional information?
So we always post our events on the website, which is grownupt1ds.org, and then social media as well. I have an email list of our regular attendees, so when I host one here in California, we have one coming up November 15th in Anaheim. I just send out an email blast saying, hey, we're doing it here at this time, this day. And then the people in the other cities do this as well. So it's email, it's social media. We do a lot on social media in announcing it. We also share on social media clips of each event after, and just you can see the fun, the camaraderie, the connections, and just how wonderful it is. So you can kind of see what's going on.
And you've also often done some fun little social media snippets at the events, right? Tell us about a couple of your favorite of those.
So I'll do something sometimes called random card draws. And so I'll have a list of cards. They pick a card, and it may say something like, if on an insulin pump, at what point, how many years into your type 1 journey did you start an insulin pump? Or it can say something like, what does support look like to you? I'd have card draws for family members and caregivers as well. So I've asked, we've had card draws that say something like, do you have fear on behalf of your husband or wife, or are you worried about their long-term health, or have you ever had to help treat a low blood sugar? Things like that. And it's kind of icebreakers, and people get really involved, and they love answering these questions. So things like that. We've had, we do silly pictures and videos and, blood sugar roll call just for fun. There's never any judgment, which I love. We don't go there just to do diabetes. The diabetes talk, it happens organically. And just the support is incredible.
And you talk about, so I've been to several of your events, and they're magnificent. And I always appreciate that there are usually at least a small handful of people who were very nervous about coming and talking and meeting other people with diabetes. Some people that have never talked with someone else about their diabetes in person ever before. Share a little bit about what that means to you as someone helping bring these events together.
Yeah, I always tell them, bring friends or family, the more the merrier. And they're part of your type 1 journey, right? They're part of your support. So they are welcome. I do get emails saying, I've been watching for a while. I haven't attended yet. I'm nervous. I'm shy. I encourage them to come. There is no such thing as a stranger. And at every event, there are new people who had never come before. Just this last one we did in September, one of my favorite things said was a gal. It was the first time. She didn't know about us. She came, and if you see the picture, there are pictures and videos of her. She's engaging, she's laughing, she's social. She had the time of her life. She emailed me after, and this happens often, saying, I didn't know what to think. I was a little bit anxious, a little bit nervous. I've been doing this alone for 36 years. But walking into a brewery and seeing a gazillion robot parts was probably the best day of my life. It was so cute. She felt like she was in the right place. She said this will have an impact on her for a long, long time. And she didn't realize how bad she needed this. And I hear this often. So I mean, people that would drive 3 or 4 hours to attend every single event. And we rotate locations. We're trying to accommodate everybody. But it's just so engaging and fun that people will drive and come.
What does the future look like when you envision maybe a year out from now? Would success feel like having several of the major metropolitan areas having events, or when you kind of dream big, what does that look like for you?
Yeah, yeah, because the impact I've seen that it's had on people. I didn't expect it to be this impact. I didn't realize what I was tapping into. Yes, my big goal and vision is to have this recreated all over the United States because there's so many people who need this and would benefit from this. It's free, it's fun, it's social, it's fighting isolation. And we learn so much from each other and from the lived experience. We've had anywhere from 2 weeks newly diagnosed to over 60 years, that type of a span who attend. I would love this everywhere. I don't have to be there. This is their baby. Whoever's leading that chapter is doing it. And if they're ready and they want to do this, I'm thrilled. I'll help guide them. Absolutely. It's needed.
Yeah, that's great. So well said. Joanne, what about you? When you think about the future for T1D to 100, and this is a movement. It's not just a website. The website is a vehicle to get the information out there, but this is really a bigger movement than just a simple website. When you think about the future, what does that look like for you?
I think what I'm realizing, I've done support groups like Kelly does, because I met Kelly when she came to my support group in my home years and years ago and stopped that in COVID. And it is extraordinary, but as there are more adult T1Ds than there are children. And that demographic is exploding at this point, and both T1 and T2. And what I see is hopefully a groundswell for the programs that we need in place to make us safe as we age, that give us the support that we need as we age, that give us the community that we need as we age. It is a lonely disease, and aging is hard and scary, and we will need support. It's like being a child, but we're at the other end of it. And we will need help. There are not enough endocrinologists, there are not enough healthcare providers, so the community has to do it. So hopefully we tap into it. I remember I had a gentleman, his golfing buddy was my CPA, and the guy was a T1D for 30 years and never met another one. And he passed out on the golf course, and my CPA said, could you talk to him? Brought him to a little meeting I had where we were testing whether Freza worked with bakery goods, and he had never met anyone else. And he was amazed that we were just all talking and connected. And he became a significant member. And he said, I never knew what it felt like. And what Kelly is doing and what I've done and what we're trying to do is let you know, yeah, you have this, but others have it. They're figuring it out. Let's figure it out together. Let's be as safe and happy as we can be. And it takes community to do that.
Yeah, you don't have to go through it alone. That's for sure. You mentioned,
and it's really important to understand we need to have an impact at healthcare settings. We need to make changes. We need to be safe, and we need to have a voice. And that's the advocacy part we're also working on.
Yeah, it's such an important piece because, you mentioned as we get older, we can begin to be treated different by our clinicians. We can begin to be treated differently by our family members and loved ones. Talk a little bit more about what that, first of all, that doesn't feel good, but also it puts us in kind of a perilous position, right?
Very much so. At this simple level, my endocrinologist, who I think the world of, asked me to visit. How are you doing? Good question. And I said, I'm just struggling. I'm just tired. And he said, oh, no, not you. You're always an optimist. And I said, no, I'm still an optimist, but I'm tired. And he said, I'm sorry to hear that. And that was the last of that discussion. And another provider said, well, what would you have liked to have said? What would have been helpful? And I said, treat us like a friend, treat us like a human being. Try to have some sense of validation of how hard this disease is and has been for years and years. And the good part is we've done so well with ourselves that we're here. And we should feel really good about that. But there's the burden and there's the cost of it. And the healthcare providers can start to understand how much of a burden this is. It's really hard to understand 24/7 unless you live with this.
Well, we're the first generations to live this long, and I feel like they're learning from us what the long-term complications are of living this long with type 1 diabetes. We don't have that data. It didn't exist before. We're in uncharted kind of territory with aging with type 1 diabetes. And the thing is, when you think about it, diabetes is expensive enough, the insulin, the pump supply, CGM. But as we age, there's the cost of more procedures, more transitions in family life or transitions in life in general, and medications. And so, I mean, that's the other thing, costs. And, it's a whole different, unique version of type 1 diabetes that's never been addressed.
Yeah, very well said. And I think about, too, how with most things in our medical journeys, diabetes does have some impact on it, but I also have experienced where I feel like my, the clinician I'm seeing might be inappropriately pointing the cause of something at diabetes when it's like, no, has nothing to do with that. Let's keep digging. And I think too, Joanne, it makes me think of what you described about talking about feeling tired and just simply asking some more questions. Like, well, let's talk about that. What are you tired about? Can we identify any sources? And if so, can we maybe think of some ways to, address them?
Absolutely. It's if your friend said to you, and you said, how are you doing? And they said, oh, I'm really struggling. You wouldn't say, sorry, here's that, and move on. You would say, what's going on? What are you feeling? Can I help you? And I don't know. We take more time. Maybe we're a burden. It doesn't matter. We still need that care, and the human touch is so important to say, yeah, you've done very well. And I can imagine that would be tiring. That would have been wonderful to hear.
Joanne, as you've been building out these resources and just topics, has there been anything that surprised you along the way? Like a big aha moment, and I didn't think about that until here you are.
I just attended a workshop with the top researchers in the world on T1D and aging. It is a kind of a new area. The person hosting it out of Harvard has been researching for 20 years before anyone knew they needed research. And what surprised me was the intensity and the passion of these researchers who want to understand what we need, who want to treat us well and explain it to the healthcare community. There were medical fellows who'd been through medical school who were going to be gerontologists and endocrinologists, and how do they treat us, and what are the words they use to deal with some of the serious stuff that we have to deal with. It was so profound in their kindness and their passion. They're dedicated. They flew in from all over the world, and they're working on it, and they want to hear from us. They send me questions to ask the group. How do you feel about this? What are you doing? They want to know so that they can figure out what needs to be done. It's astounding.
We're talking about the fastest growing group and the most underserved group. There's just not enough out there. not enough info. There's no work, nobody serving this group. So it's been needed.
I think early on I talked to Bill Polonsky and Paul Madden. I called them on a Zoom and I said, there's this thing with aging diabetes. And they said, well, what thing? And Bill Polonsky said, I don't get it. You get to live longer. What's the problem? And I said, no. We're entirely grateful. And the technology is amazing, but nobody knows what to do. And it's different. And we need to address that. He goes, oh, I get it. It is a different phase. And it's just becoming something that people are aware of. And the ones that are going to make the noise are going to get the attention, and that's what we need to do. We need to say, we need to address this. I asked the local hospital, could we please have wristbands when we're in the hospital? Can I have a paper wristband like you put on like fall risk or allergic to penicillin, so that when anyone walks into the room, caregiver, I can say, I have type 1 diabetes. And I was told it would take 5 years to get through compliance. It's a paper wristband. So I printed out 500 wristbands for $75. And the last time I was in the hospital a couple of months ago, during pre-op, I put my wristband on and I told the nurse, I'm going to be putting this on now. It says I have type 1 diabetes. And she's, you don't need that. And I said, well, actually, yeah, I think I do. And then she took my history and she says, I see you have type 1 diabetes. Do you need insulin? And I threw my hands up and said, that's why I have a wristband, because you need to understand type 1 diabetes. All type 1s need insulin. So it's always an education. It's how do we take care of ourselves and educate as we go.
Yeah, that story gives me kind of goosebumps in not such a great way, right? Like it's a little scary thinking about that.
It is, but there are things we can do. And several people that I know have now printed their own wristbands. I mean, it's different than our medical alert, because they don't pay attention to that, or they tell you to take off your jewelry. So this is important. We're putting together a list of 5 points that will sit on a nightstand if you're in the hospital, saying, I have type 1 diabetes. In order to print, I need insulin when I need insulin. I need glucose when I need glucose. 5 points, just simple things, so that we call attention to what we need.
Yeah, that's
it's just the tools we need to do to be safe and share in the community.
Yeah. Kelly, can we turn back to your meetups for a moment? And when you think about the meetups that you facilitate and bring together, compared to maybe something that's like an all ages group, what do you feel makes it a little bit different or special to be able to spend time with people in a kind of a like-minded or similarly aged group?
Well, just the level of understanding what you're going through, and people, talking and sharing life experiences, and just the relatable. So here's an example. I lost my hearing in my early 30s, and it is diabetes related. Back then, they had no connection. And I feel like those of us living with type 1 diabetes a long time have hit those walls of frustration where I've always said I felt like I'm from Mars, because they don't know, but so the hearing loss thing was one. And earlier this year, we hosted an educational event. We collaborated with the Behavioral Diabetes Institute and TCOYD, and it was fantastic. I had a request from a gal who I'd never met and said she wanted to attend, but she demanded that I had an ASL interpreter, that she was hearing impaired. And I go, whoa, I didn't know what to do or think. This is my first time. And I said, oh, I'm hearing impaired too, but as a newly formed nonprofit, I don't have the funds to, and then she came back pretty strong. And I thought, wow. So I was a little bit like frazzled, but I put out social media, sent out an email blast, and within 2 hours, I had a gal who lives with type 1, who's an ASL interpreter, offered to come and do this. Now, this girl, since she and I have become friends, and I'm so proud of her for advocating on behalf of herself. And then she emailed after saying, Kelly, you don't know the impact this had on me. This is the first time I've been able to be in a room with a bunch of type 1s and attend something and hear, or not hear, but know what was being said for decades. And then our last meetup in September, a guy who was hearing impaired came. There's this other connection we've all made, that there was these connections within connections, and it's the people who survived cancer with type 1 diabetes, and it's the people who, the menopause thing is a big one. But all the other, whether it's celiac or, dealing with caring for an aging parent and the stress involved and just navigating life with this complicated disease. And so I feel like a lot of us are in different places, but in the same kind of arena in life where we probably won't find that if we're going to something that's aimed at children or the young adult, who they haven't been married yet. They're not even getting mammograms yet. It's different. It's very different for us.
Yeah, you bring up a good point about, living with diabetes doesn't make us immune to other health conditions or things that are just common in aging. And we don't have to go through those in isolation. I also think about the value in when we bump into a complication that our life doesn't stop. We find a way to deal with it and kind of integrate it into our everyday lives. But we can't do that without having a safe place to discuss and talk about that.
I agree. The peer support, we had a gal, this was over a year ago, who emailed me. I never even heard, everyone just mingles together. And it's not me trying to get involved in direct. I trust this community. They take care of each other and they form these connections. Well, one gal who is in her 60s and she's a social worker who needed injections for her eyes, was terrified. She emailed me after the event saying, I spoke to this person, this person, this person. Will you please thank them? And thank you, Grownup T1Ds, for this event, because now I feel brave enough to have the injections. And then she emailed me after saying, it wasn't as bad as I was expecting. They were right. Please thank the girls for me. And then just recently at our last meetup, a gal who was having a great time socializing and so on. At one point, we're sitting at a table talking, and then she breaks down in tears. She had this built-up anxiety and fear. She started crying. Now, these are things that actually happened. She started crying. Same thing. It was an eye. She had a pending eye surgery. They're telling her she had to have, and she was terrified. And I see the one gal walking by, the social worker, and I'm like, come here. And they said, please talk to her. And this gal was swarmed by everyone who were cheering her on and comforting her. And it's just so beautiful how people can let go of their own issues and just, it's not me. They're so ready to comfort somebody else and support somebody else.
Yeah.
The other benefit in the localized groups, either Kelly's or other ones, are that you can start to develop awareness of who the caregivers are in the community. I keep a list for the local county, and every year I say, who do you go to for this, this, and this? Who do you like? Who do you not like, and why? And I publish the list, and it helps people. We all have different needs for our caregivers. But if you're in a localized area, so if Kelly's in Boston, the Boston people would say, this guy is good. Stay away from this guy. He doesn't seem to care, or he doesn't know about this kind of technology. It's sharing that information and what it is you need and you're getting, so someone understands it. It's a great resource.
Yeah, we had a gal reach out who was diagnosed only a year ago. And she was telling me she cries when she goes to the endocrinologist. This person is cold, blames her for, she's a year into this. She's still trying to figure it out. She's a stay-at-home mom, and she's got a child with a disability, and she's got a pretty full plate. anyway, so I asked her, what insurance do you have? So she told me. So I reached out, sent an email. Again, within maybe an hour, I had a gazillion referrals, and there were quite a few for this one in particular, one practitioner that everyone loved. So the girl was able to call, get an appointment with that doctor. And she literally texted me the day she was there saying, I can't even wait to get home. I'm texting you from the parking lot. This has changed my life. She was crying. She took a picture with the doctor. They sent me this picture. It wasn't me. It was, our community who helped. But yeah, that happens a lot because, not everybody gets lucky in finding someone who they mesh with and they feel seen and heard from.
Yeah, what a great story.
Yeah.
All right, so Kelly, if you think about, you talked about what success looks like, what what you dream of in the future. What do you need? What do you need to make that happen? What's on your dream wish list?
Well, first of all, we are a newly formed nonprofit with no funding. So funding would help because there are fees. There's fees for the website. There's, my brain, you guys, high blood sugar. I'm dragging. There's, fees to running this, but also because I'm paying fees in different states to start the new chapters so that we do reach more people and benefit more people. Again, they're free events, so it's beneficial, but so we do need donations. The other big ask right now, and I haven't had time to put it out there everywhere on social media, is as many emails as I'm getting and requests on behalf of opening a chapter in other cities. We're looking for chapter leaders who are dedicated and want to take this on. It is extremely rewarding. And if you're social and you love being around other people, you're going to thrive on this. So yeah, we're very open to others who would love to take on their very own chapter of Grownup T1Ds in their city.
You heard it here, folks. If you have an interest, then reach out to Kelly. We'll be sure to put the link in the follow-up email and get you that information. Joanne, same question to you. When you think about the future, what do you need to make that happen on your side?
I was hoping you'd ask that. I am not set up as a nonprofit, nor am I running this as a business because I just don't need or want to do that. I just want information out, but I need volunteers. I need help with people with the same mindset of understanding what information we need to share and how do we type up these little cheat sheets and how do we get that. I've got a social media person, but I would love some assistance on social media in terms of the knowledge of diabetes and the knowledge of aging. I've got a young person. She doesn't know diabetes and doesn't know aging, but she knows social media. So I could use that end of the input. And on advocacy, we're trying to make some inroads at this point in terms of paying attention to this demographic. And so those who are interested in being part of the team on advocacy, setting up a group that just really is focused on that, that would be fabulous as well. I am also looking for a behavioral psychologist who really understands aging. I wish it were easier. I want someone who really can teach resilience and is willing to give some time just to talk to our community, to do some Zoom events and discuss it. So that's my need list right now.
Good. I'm glad. Thank you for sharing that. Just taking a look at the time, we are reaching that point where I'd like to ask you each for some closing thoughts. Kelly, I will turn to you first, and then Joanne, I'll come back to you, and then I'll do some closing housekeeping and wrap things up here. So Kelly, any closing thoughts you want to share?
Yeah, I feel very strongly about the human connection, and I feel that peer connection isn't just needed; it's urgent, and especially for this group. And we need to reach more people, get out further, I've seen the impact it's had on people. And I would really like to continue helping others to fight the burnout, the isolation that happens with aging. We already deal with living with type 1 diabetes and serving the community, and then advocacy, of course, and, to get more people involved in advocacy, we need that. But yeah, and just to continue building Grownup T1Ds, it's been such a pleasure. Yeah. So I hope more people follow or step up in hopes to open a chapter in their city.
Well, Kelly, thank you. As a grown-up T1D who benefits from your amazing events, I very much appreciate all the time, effort, and energy you put into it. And I look forward to watching it continue to grow.
Thank you.
Yeah. Joanne, how about you? Closing thoughts from your side?
Well, first of all, thank you. Thank you for this opportunity. Thanks for connecting with me on this. And I think what will be our ongoing discussion of how this moves forward and gets some legs. I am more at the tail end than where Kelly is. She covers that broad range, but I am really looking at the part where things start to get harder and harder. And how do we help our community without terrifying them, without scaring them away, but getting them prepared and giving them tools? I can give fish, or I can teach someone how to fish, and I think that's my best ability. Anything that gets us into nursing schools, healthcare communities, ADCES, and says, pay attention to this demographic. We're going to need help, and we need your involvement. The voices out there, I really look forward to that. It's important. I want people to live well. I want them to smile as much as they can and enjoy their life as their days go a little bit shorter. That's my hope.
Very well said. I thank you, and I appreciate all the time and energy that you're putting into this important topic. I can already see that it's growing legs quickly, and it's there's a need for it. There's a big appetite for it, and even just today, people talking about how much they value this information. So thank you very, very much. Joanne and Kelly, thank you both so much for being here today, and thank you for everyone that joined today. I hope that you're leaving with a bit of a clear understanding of why this is such an important topic, and that you feel at least a little bit better equipped, or at least know that there are people out there thinking about this and working on it and pulling resources together. So I will be sending a follow-up email with the recording and resources and slides and links and everything that I can get my hands on to get this out there. And of course, happy to continue this conversation. Bring Joanne and Kelly back. We can do these webinars as much as you, the community, wants to watch them. The only time I have trouble justifying a webinar is when I do a webinar and no one shows up, and I have to explain to my boss what we're doing here. But this has been fantastic. So thank you all for spending part of your day with us. And your continued commitment to learning, connecting, and living well with T1D. You can take a look at our website. We have an events page at bluecirclehealth.org/events to stay up to date with future Blue Circle Health events. We also publish them out on our social media channels. We are at Blue Circle Health on most of the socials. In terms of some upcoming events, we have group sessions in English tomorrow and Friday, and then the Spanish session on the 13th. Now, our group sessions are private for Blue Circle Health participants, current or past, but these webinars that we do, they're always going to be open for everybody. And then for anyone here today who may not be familiar with what Blue Circle Health is all about, I'm going to stick around and share a quick 5-minute overview and answer any questions. We'll let our panelists drop off, and anyone who's already familiar with us, you can drop off. So Joanne and Kelly, thank you so much for your time, and
Thank you.
we'll see you again soon. I'm going to just walk through a quick overview of what Blue Circle Health is all about. You can share any questions you have along the way in the chat, and I'll keep an eye on them and answer them at the end. And this really should only take a couple of minutes. So the big picture idea here is that people with type 1 diabetes shouldn't have to fight for what they need to live. So Blue Circle Health created a free 6-month virtual care, education, and support program for adults with type 1 diabetes, so you can focus on living and not just surviving. Our mission is to learn the best ways to care for people living with type 1 diabetes, to apply those learnings to care for as many as possible, and to share our learnings to improve type 1 diabetes care everywhere. And Blue Circle Health is made possible thanks to generous funding from the Helmsley Charitable Trust. So what exactly does that mean? Well, we offer a free, flexible program to extend care between visits. Our program is up to 6 months long. It's done entirely virtually over Zoom, text, and phone. You stay connected to your medical homes, and we send them regular updates throughout the program. Our services are free regardless of insurance and immigration status, and re-enrollment is possible 1 year from the original enrollment date. The program also offers as much or as little support as requested, so you can take advantage of every service we offer or pick just the ones that you need. The graphic on the right shows the available services, and I'll describe them in a little more detail, going counterclockwise and starting with clinical care. So clinical care, it's exactly what it sounds like. It's visits with an endocrinologist or advanced nurse practitioner. We have insurance navigation. So this is consultation with insurance specialists who can help you understand and maximize any insurance coverage you may have. They can also help you find insurance coverage if needed, and they do also help with prior authorizations. Next up is diabetes supportive counseling, which offers help with the emotional burden of T1D. We have case management, so our case managers can help if you're struggling with food, housing, or employment insecurities. We also have peer support and community. So in addition to the monthly group sessions you heard me mention, you have a dedicated T1D support guide to work with who will help you navigate all the other services and just be there for you if you just need someone to talk with. And then we also have ongoing community events like this and connections to other great type 1 diabetes community organizations. Next up is education and nutrition, so visits with registered dietitians and certified diabetes care and education specialists. There are 2 additional programs available within the Blue Circle Health program. The first is a prescription assistance program for qualified applicants who need help paying for their supplies and medications. The qualification for that is an income level at or below 300% of the federal poverty level. And then the other program is an Intro to CGM program, which provides 3 months of free education and access to a CGM for those who have not had reliable access to one before. We are now available in 17 states and Washington, D.C., with more coming soon. And we've helped almost 1,000 participants since January of 2024. So this all sounds great, right? You must be wondering, how do I get involved? It must be really hard to get involved in the program. And it's surprisingly easy, at least in my opinion. And our goal is to make it easy. So the eligibility requirements are as follows. You have to have a diagnosis of type 1 diabetes. And note, this is not just for newly diagnosed. We're here for you anywhere along your T1D journey. And yes, this does also include things like LADA. We are only serving adults, so you have to be 18 years or older. You have to speak English or Spanish. You do have to be able to connect and participate in virtual care. So that typically means access to a smartphone or computer for Zoom video calls. You do also have to have a primary care doctor or an endocrinologist, or be willing for us to help you connect to one. We need to know that you have a safe place to land when you're done with our program, and we can work with your either existing providers and healthcare professionals or get you connected with one to make sure that's the case. You do need to live in a state where we're licensed, and then no current pregnancy. Pregnancy, we feel, really needs that in-person support. Again, the list of states that we're available in is growing fast, and the best way to keep on top of it is to head to our website for the most current list of states. When it comes to getting started, it's really just 3 easy steps. You can sign up on our website at bluecirclehealth.org. You can fill in a little form there, and then we will reach out and contact you to create a plan that meets your needs. That initial outreach usually happens within just a day or two of filling out the information on the website, and then you start your T1D care and support program. I'm going to play a short video from a few of the people who have gone through the program. It's about 3 minutes long, and while that's playing, go ahead and share any questions you might have in the chat, and I'm happy to stick around and answer them.
When I explain it to people, I usually say,
living with type 1 diabetes is pretty burdensome,
complicated. It's really, really tough.
challenging.
Too many ups and downs.
I'm never not thinking about it.
I lose a lot of sleep. It's very emotional.
The only predictable thing about type 1 diabetes is that it's unpredictable.
It makes me feel really vulnerable and afraid. And I don't like feeling afraid and vulnerable with my diabetes.
My daughter was diagnosed when she was 3. You know, if I couldn't afford for both of us to get supplies, and I'll just literally take the shirt off my back, take the insulin out of my body and put it to her.
like, it's a battle every day. And insurance shouldn't be such a fight.
I literally spent days on the phone calling the provider, calling the pharmacist, calling the insurance, calling the pre-op company, and then calling all those people again to tell each other what the other one said.
It's like everyone's pointing their fingers at someone else. In the meantime, I'm watching my supplies dwindle away to nothing.
Like, that's a constant fear, you know?
And so things that feel like a fundamental right are out of reach for many people.
It's just wrong.
A friend of mine on Instagram sent me Blue Circle Health, so I immediately signed up.
Blue Circle Health is a nonprofit with a free clinical care, education, and support program. We deliver our program entirely virtually. It's all telehealth, and it's up to 6 months long.
You get education, you get support, you get assistance navigating insurance. It's phenomenal.
I don't know where I would be right now if I didn't find Blue Circle Health. They picked me up when I was at one of my lowest points.
It's just honestly a godsend.
Felt like they get it. It felt like we're making the change that we should already have. We were really fortunate to have funding from the Helmsley Charitable Trust to make this possible and create this program and be able to offer it for free.
My life has drastically improved. I have really great insurance. The insurance counselor through Blue Circle was amazing. Not much makes me that emotional, but having to not worry about the financial aspect of that as a single mom who's rebuilding is, yeah, it's really comforting. Yeah, I'm crying.
And if Blue Circle Health can get out there and show people that this is the right way, it's the right thing to do. You don't have to go through it alone.
All right, thanks for watching that. And again, if you want to get involved or have more questions, the best thing to do is head to their website at bluecirclehealth.org. Just taking a quick look at the chat, and I think I've got all the questions answered, but certainly feel free to reach out if there's anything that I can help with. You can email us there on the screen, info@bluecirclehealth.org. And then keep an eye on our events website, bluecirclehealth.org/events, for more information about upcoming events. And I just really appreciate you all taking time out of your day to spend with me and Blue Circle Health here. And with that, I will end the webinar and wish you a great day. Thank you.